Your next item for discussion is item number 2, entitled Review and Continue Local Health Emergency Hepatitis A Outbreak Authority to Contract. This item has been pulled by the Chief Administrative Officer for a presentation. We also have one member of the public who wishes to speak in favor of this item.
We just lost a quorum, so we'll have to wait a minute till the vice chair returns.
While we have the opportunity, I would like to note for the record that item number 16 adopted an urgency ordinance to add Chapter 15 to Title 3, Division 2 of the San Diego County Code of Regulatory Ordinances related to temporary area restrictions necessary to preserve public safety, health, and welfare to take effect immediately. Thank you.
Okay, we're good to go with staff report.
Good morning, Madam Chair, members of the board. On September 1st of this year, the County Public Health Officer issued a declaration of local health emergency pursuant to Health and Safety Code Section 101080 as a result of the outbreak of increasing numbers of hepatitis A infections. On September 6th of this year, your board ratified that declaration. We are here today pursuant to the same Health and Safety Code to request that your board find that there is a continuing need for the local health emergency. Dr. Wilma Wooten, our Public Health Officer, will provide a brief update on the Hepatitis A outbreak and our efforts to combat this public health incident. And joining her is our agency's Chief Medical Officer, Dr. Nick Hepatitis. Following Dr. Wooten's presentation, we will also have an update on the efforts within the unincorporated area that Sarah Agassi, our Deputy Chief Administrative Officer for our Land Use and Environment Group, is leading, and joining her is Amy Harbert, our Assistant Director for the Department of Environmental Health. Dr. Wooten.
Thank you, Nick. Chairwoman Jacob, members of the board. Since our last presentation, management of the hepatitis A outbreak has continued through numerous county departments, working with community partners and city jurisdictions. In addition, other key actions taken since September 6th include activating the Medical Reserve Corps as of September 13th, activating 211 statement of work for a public health threat, activating HHSA DOC on September 18th, activating conducting one-on-one meetings with local municipalities to provide hepatitis A briefings and presenting at several of their city council meetings. We have continued to implement a response plan focused on three core strategic efforts: vaccination, sanitation, and education. First, to update you on the number of cases and the demographics related. There have been 461 confirmed or probable outbreak cases from November 22nd through September 19th. 315 or 68% have been hospitalized. We have had 17 deaths. For gender, females make up 1/3, with males making up 2/3 of the total number of cases. The age range is from 5 to 87 years of age with a median age of 43. The 5-year-old is the only child that has been infected here and was not previously vaccinated. The majority of the cases range in age from 24 to 65 years of age. And you see there the breakdown of the exposure type. 154, 33% are homeless and illicit drug users. 78 or 17% are homeless only. 56 or 13% are illicit drug users only. 116 or 25% are from neither of those groups, but many of those in that group have relationships or work with or have contact with the three at-risk groups. And then lastly, the remaining 57 or 12% have an unknown status due to the fact that we do not have medical records or have been unable to interview those individuals. Now I will update you on the three strategies specifically. As it relates to vaccinations, Over 42,000 total vaccinations were administered across the county as of September 23rd, of which nearly 36,000, or 86%, were given to the at-risk populations of unsheltered individuals, illicit drug users, or both. The overall total includes 15,662 vaccinations given by our county staff through field events, which include foot teams, mass vaccination clinics, and mobile vans, as well as at jails and detention centers, the county TB and STD clinic, and the county psychiatric hospital. Another 22,406 vaccinations were provided by our community partners in our healthcare systems, federally qualified health centers, and through pharmacists. And 682 vaccinations were provided as post-exposure prophylaxis. Lastly, we have administered 3,290 vaccinations to food handlers and at-risk professionals. As an aside, when we addressed your board on September 6th, we reported 109 foot team events. Your board asked that we increase the number of foot team events, and since that time, an additional 220 foot team events have been conducted. Also, since September 6th, we have continued comprehensive strategies such as vaccinating at jail intake, emergency departments, substance use disorder treatment programs, homeless service providers, and partnering with our homeless outreach teams. And in fact, we are coordinating directly with our behavioral health services programs to systematically educate and offer vaccinations to program participants who are considered part of the at-risk population. Upon intake, all clients are provided education about the outbreak and either offered their vaccine on site or are referred directly to a nearby location offering the vaccine. In regards to sanitation, the City of San Diego reports that they are sanitizing their streets on Monday, Wednesday, and Friday of each week. The county has distributed over 4,400 hygiene kits and placed a total of 66 hand washing stations, 63 in the City of San Diego alone, and 1 each in Oceanside, El Cajon, and Escondido. And we have a request from 9 additional cities for over 100 hand washing stations that are in the process of being deployed. In regards to education, to get the word out to the public, we've issued a total of 9 news stories, held 1 press conference with the City of San Diego. We've issued 8 health alert notifications to the medical community and conducted a health care provider symposium and met with the Hospital Association of San Diego and Imperial Counties. We've provided over 100 presentations to the public, met with city leadership from affected jurisdictions, and distributed numerous flyers, frequently asked questions document, and fact sheets on the outbreak. Since June, the County of San Diego Department of Environmental Health has been communicating with more than 14,000 permitted food facilities in the region about hepatitis A, providing disinfection guidelines, cleaning methods, how to prevent the spread of the illness, the importance of hand washing and good hygiene, food handler employee health guidelines, and the public health officer's recommendation that all food handlers in the region be vaccinated. This information is available in 5 languages and is posted on the county's website. DEH regularly disseminates hepatitis A information and updates via our email-wide distribution list, each time reaching more than 8,000 restaurants and food facilities, 3,300 hazmat permitted businesses, 2,700 agricultural growers and farmers, and 2,400 public pool facilities. As indicated previously, food inspectors were provided guidance information to operators during more than 6,200 inspections. DEH continues to expand outreach to businesses throughout the region, including permit holders, applicants, and stakeholders in community organizations, and have additionally reached out to more than 3,150 unincorporated contacts. This last slide that I will share with you is a list of industry partners that we have collaborated with. DEH has shared this educational information with these groups, including California Restaurant Association, San Diego Food and Beverage Association, and the Hotel Association, as well as San Diego Schools and Food Banks and Pantries, all reaching member networks and contacts in the thousands with hepatitis A vaccination, sanitation, and education messages. The California Restaurant Association continues to distribute information to more than 1,800 members of their statewide network, and the San Diego Food and Beverage Association continues to notify 10,000 food handlers and members in the San Diego region. And education efforts naturally cross over to our vaccination efforts. We are working with stakeholders to encourage them to vaccinate food handlers. Nearly 600 were vaccinated at an event in partnership with the California Restaurant Association last week. We are all working with food industry and pharmacy partners and have piloted a program for pharmacies to offer the vaccination for this recommended occupational group on behalf of the county at their convenient pharmacy locations. This pilot has vaccinated nearly 200 food handlers, and we are looking into expanding this pilot with other pharmacies in the region. The county continues to expand its hepatitis A educational efforts, reaching throughout the region, and guidance to operators of casinos, regional park and recreational facilities, airports, and detention facilities, and will continue to partner with stakeholders in the community to convey the hepatitis A protection and prevention messages. Now, Sarah Agassi and Amy Harbert will present the county's responses in the unincorporated areas.
Thank you, Dr. Wooten. In addition to the county's region-wide efforts, our organization has been responding in the unincorporated community. The unincorporated geographic area is 3,570 square miles, or 84% of the total area in our region. It is more rural, and unlike some cities, has less urban areas with dense populations. To date, there have been 38 cases throughout the unincorporated area. Of these cases, there have been no known association or clustering in a single geographic location, other than at specific facilities where we were able to follow up and provide facility operators with disinfection guidance and offer vaccination to potentially exposed individuals. None of the 38 patients are currently infectious to other people. Half of the 38 cases are homeless, illicit drug users, or both. We encourage vaccination to the at-risk individuals and those populations that have been recommended for vaccination by the public health officer. Since July, public health foot teams have provided nearly 300 hepatitis A vaccinations in communities of the unincorporated area through 24 field visits and focused vaccination events. Through employee benefits, the county has provided more than 2,000 vaccinations to employees who are part of the occupational groups recommended for vaccination. We have several existing efforts in place for monitoring, cleaning, and when needed, sanitizing. These actions aid in mitigating the potential spread of hepatitis A. The Department of Parks and Recreation conducts daily monitoring and maintenance of the parks, which includes cleaning and disinfecting areas whenever needed. We also power wash areas in the park, including hardscape, playground, and fitness equipment. This is done on a weekly, bi-weekly, or monthly basis as needed. Public Works staff inspects county roads and flood control facilities on an ongoing basis and removes sediment and debris as part of our regular maintenance program. When we have roads, flood control facilities, or open spaces with overnight homeless presence that require cleaning, we post these areas at least 72 hours in advance, and we return as a multi-departmental county team, including integrated services, to provide services to homeless individuals prior to the site cleaning. A similar multi-agency approach is deployed when there is joint public and private property cleaning efforts. This approach was successfully deployed recently at several flood control and road locations in Lakeside. Private property owners may also be unaware of the conditions of their undeveloped land, especially if they don't live there. When a concern is identified on private property, we notify the owners so they can address the situation. We are sharing Hepatitis A educational information with unincorporated area permit holders, businesses, stakeholders, and community partners. Organizations we have reached out to are listed on your screen. We are sharing the importance of vaccination for the recommended at-risk groups, disinfection guidelines for public restrooms, good hygiene and hand washing, employee health guidelines, and what members of the community can do to help prevent the spread of illness. Additionally, our field inspectors are providing this information during routine inspections. Looking ahead, we will continue to make proactive education and outreach our practice so the public health messages for combating hepatitis A continue to reach our unincorporated communities. Public health will continue their foot team and focused vaccination events in the unincorporated area. Working with integrative services, multi-departmental county teams are conducting field assessments to locations of observed overnight homeless presence to assess present conditions. Similar to other jurisdictions, the county is evaluating if there is a need to expand access to hand washing or public restrooms. Where needed, we'll be taking actions to enhance sanitation. At this time, street sanitation with bleach has not been determined to be needed. We are proactively updating our protocols and service contracts for cleaning and sanitizing various surfaces. We will be prepared should new or enhanced methods be needed in the future. We will also continue to stay in close contact with other jurisdictions facing this challenge to ensure we are learning and sharing with each other.
Thank you, Sarah. And as mentioned, as we have from the start of this epidemic brought all county departments working together, we have done the same in communicating and collaborating with all of our health and healthcare community partners. We're committed to expanding more partnerships, although it's all hands on deck. As we continue to coordinate a regional response with our cities, we're also meeting with the city managers tomorrow afternoon to discuss action plans and coordinate steps and provide additional assistance as needed. Yesterday, we had a call with the Federal Centers for Disease Control, who were very complimentary of the County of San Diego's public health response and the vaccination efforts and education, and are actually coming here next week, and we're having a planning meeting with CDC to meet with our providers to provide whatever assistance CDC can provide to us as at the start of this epidemic working together. Madam Chair, this concludes our presentation. We're available for any questions the board may have.
Thank you very much, all of you, for the presentation. I want to reiterate something that was said at the last meeting. The county's legal authority in cities only extends to vaccinations. That's it. Otherwise, it takes the city to cooperate on the other end. In that vein, I want to highlight what the city of El Cajon has done. I think the city of El Cajon, while it hasn't been mentioned very much, they took it upon themselves to reach out to the county, and the county went in, and it's a high level of partnership and a high level of cooperation, because of all the cities, city of El Cajon has the second largest population, as I understand, of homeless, and then thus the potential outbreak of the Hep A. So I want to thank the city officials for that. I think they should be recognized for the way they have handled this particular epidemic. And I also want to thank the staff on the Lakeside, the culvert issue. It's very unusual in the unincorporated area. And while in the unincorporated area, the county has the ability to do it all. The vaccinations, the sanitations, the education, if there's wash stations or porta potty, whatever, we have the authority to do that, and I applaud you all for being aggressive on that. I have just one question, if you don't mind, Vice Chair. since I sit as a member of the San Diego River Conservancy Board, there have been some issues raised about the water in the river, and there is some, even though it's not raining right now. But Dr. Wooten, you and I spoke about this yesterday during our briefing, and I had asked you some questions about what are the risks of those in the river and so on, and I think it might be appropriate to just share the conversation we had yesterday so that everybody knows.
Chairwoman Jacob, anytime when there's a rain, everyone obviously knows that we tell people to stay out of the water because of the potential association with being exposed to increased germs, usually it's bacteria, but viruses can be there as well. But with this outbreak, the question is commonly asked, is it associated with the Tijuana River? And it is not associated with the Tijuana River. In fact, Tijuana hepatitis A cases are a different strain than the strain that is responsible for the outbreak that we are seeing here in San Diego. The strain associated with our outbreak is 1B, and hepatitis A infections in Tijuana are associated with 1A. And their number of infections are actually, compared to the same time last year, lower, almost half of what they saw the same time last year. Tijuana is not having an outbreak, and they have had no cases to date that we are aware of, similar to the strain that is responsible for the cases causing the outbreak here in San Diego.
Now, we went from the San Diego River to the Tijuana River. Could we go back to the San Diego River?
Oh, yes.
In our conversation yesterday, you indicated to me if there was Hep A present, somebody'd have to actually drink the water in order to come down with it. Is that fairly accurate?
The transmission of hepatitis A is through oral consumption of a contaminated food or beverage or drink, or putting other things in their mouth that is contaminated with the virus. So people do live along the San Diego River. We have foot teams that go into the riverbeds and offer vaccines. If people are exposed to the water in the river, again, they would have to drink the water in order to contract hepatitis A. So again, this supports the utilization of good hand washing hygiene, no matter where you are exposed, whether it's the San Diego River or whether it's anywhere in the environment, wherever people go throughout the county. Washing your hands before you eat and before you, after you go to the bathroom is really important to prevent transmission of this virus.
So we have several jurisdictions along the river. We have the unincorporated area, Lakeside and so on. Then we have the city of Santee. Then we have the city of San Diego. So can you explain what has been done, what the county has done within those other city jurisdictions along the river, as well as the unincorporated area? I think Sarah covered that pretty well.
Chairwoman Jacob, as far as for the unincorporated communities, as you know, we have the culverts and improvements that we've made in that area, but we also have field assessments that are taking place actually this week and have in past weeks as well, so that we're able to assess and have a plan in place as it relates to how we move forward in combating Hep A within the unincorporated communities.
Are you doing vaccinations?
Yes, absolutely. It's with the foot teams and then also in close coordination with integrative services as well.
Okay. How about in the city of Santee along the river, in the city of San Diego along the river? Are we doing vaccinations there too?
Yes, we actually are vaccinating along the entire river there. Since the last presentation, we increased efforts to go into areas that we had not gone to before. So that's what we've been doing since since our last presentation to you on September 6th.
You've been busy.
We've been quite busy, thank you.
Well, thank you. Vice Chair Gaspar?
On that same note, I did want to take a moment and commend our team for the work that you've put in. The criticism has been that the county has sat there and has done nothing while we have this public health crisis out there. And it's a most unfortunate message, and it's being spread by elected officials, it's being spread by candidates for office. And there are plenty of issues to take on as a candidate for office. And I'm just hopeful that presentations like this help inform the public of the number of things that the county has been diligently taking part in over the past almost a year at this point in time. I just have a couple of questions for you. Number one, I've received a number of communications from members of the public wanting to know how they can also be of help and be a good partner in this. This can be our local physicians, our nurses wanting to volunteer. Is there any way at this point in time for the public to be involved and engaged?
Thank you, Supervisor Gaspar. As Dr. Wooten mentioned, we just activated our Medical Reserve Corps. We have also been very fortunate to have community-wide forums, one specifically last week at UCSD at Hillcrest, that involved providers from the entire health ecosystem, if you would, of the county. Last week, Supervisor Roberts, along with Mayor Faulkner, myself and some others, had a meeting with the CEOs of all the health systems. We are in discussions with some health systems and others about a coordinated effort in terms of making sure that there is a coordinated regional response. Much of that is now being arranged. Individuals are reaching out. I think the most practical short-term strategy for medical professionals is going to be the Medical Reserve Corps.
Excellent. And one more question revolves around the, let's see, the page of the report that breaks out the various groups, the suspected exposure types. And currently listed as neither homeless or an illicit drug use association are 116 individuals that you mentioned might have a relationship or interaction with those other two groups. Is there a better way to break out that number to provide a clearer picture for just people that are completely uninvolved with the two groups mentioned? Because I know that there's this heightened level of concern, which of course trickles down and has impacts on our small business community, our local restaurants, for example, people that might be considering traveling to San Diego. We want people to be informed, but we don't want people walking around so fearful to touch a doorknob. So is there any possible way that we might be able to break out that 116 better?
Well, we actually have staff and an epidemiology fellow from CDC working on that at this time to characterize that group of individuals that are not in the at-risk groups. So we will have more information on that in the coming weeks and months. But right now, we do know that a significant number of that group has had relationships with or worked with or had some association with, I would characterize it that way, with the at-risk groups. But a significant number has not. And again, the staff and the CDC epidemiology fellow will be working over the coming weeks to try to characterize any relationships or demographics of that group more closely.
Excellent, thank you.
If I could just make an echo to that, you would think, well, why wouldn't that information be available, sooner? Based on the nature of the biology and being able to track in the incubation period, it's actually a very labor-intensive effort to be able to track all of those individuals, what their touch points were, and so forth.
Okay, great job, county team, keep it up. We're not through this yet. Is there a motion?
Chairwoman Jacob, we do have one public speaker.
Oh,
I'd like to invite forward Catherine Rhodes.
sorry, Catherine. Almost forgot you.
Thank you. Catherine Rhodes, and just a few little things first. The Wi-Fi is not working for the public. All the Wi-Fis are locked, so people like me can't go onto the Wi-Fi. I was going to ask if you could, have that available for the public. Also, in your communications received, item 13, I forgot to put a thing for that. There's no list of any of the communications. I can't confirm it because I can't get on the internet, but if you go there, there's usually a list of what your communications are. So I think this communications received should be put back on. And then sometimes with your communications received, you only have a PDF file and it doesn't have any live links to the actual documents.
Did you want to speak to item 2?
Yes. And so for item 2, hepatitis A, there's no discussion on how much money you have used so far, how much money has been spent so far, or how much you're going to be spending in the future. I think you should have events here at the County Board of Supervisors so people like me could come here and get my hepatitis shot that I haven't gotten yet. The 5-year-old, is that person okay? Is the child okay? Was he hospitalized? Or did he die? I have no clue. I'd like, of course, more information on the breakdown of people that are coming. On July 1st, 2017, you guys almost tripled the fee for hepatitis, HIV, and STD vaccines from $15 to $40. So, and you did that on consent. I think you should bring it as an emergency thing. I think you should bring all those back down to $15 each, so the poor can actually take care of themselves and not have to try to come up with 3 times as much as they previously had to. Mayor Faulkner said something about the hepatitis A was first in El Cajon, and then some people were saying, no, it's in San Diego. So that was a question at Sandig. Where did the hepatitis A start from? Was it El Cajon or is it San Diego? And then I want to challenge again the county, your staff, because when I talked to the Department of Finance, they said, I can't get the city to do anything. The same people that I'm sure that stopped you guys from getting your permits for your hand washing stations are probably the same people that are doing this corruption. It is your people at the city, so you're talking to the people who don't want anything to change and want to hide information. So anyway, Health and Safety Code 34182 and Revenue and Taxation Code 95.3. When I talked to the Department of Finance, they said that the County of San Diego could use this for audits. It's actually the County Auditor Controller Administration Fee. And then another administration fee for Senate Bill 2557. So if you wanted to, you can. But the thing is that staff is, the people are, you could tell them exactly what the audit should be. And I hope you do.
Thank you.
That concludes public testimony on this matter.
Dr. Wooten, do you want to respond to the 2 questions that she asked?
Well, 2 points. We aren't recommending that everyone run out and get a hepatitis A vaccination. The CDC does recommend that for anyone who feels they should get one, but it is not a universal recommendation as we have for influenza, where everyone 6 months of age and older should get a flu vaccination. And then secondly, regarding the fees at our STD clinic, that is an administrative fee for the visit. That fee went up from $15 to $40. It does not in any way cover the entire cost of any visit at our clinic. And if people cannot pay the fee, it is waived. So it is not a barrier for care.
Thank you. And this started in El Cajon?
Yes, our very first cases were actually in El Cajon and La Mesa area, but quickly moved to downtown, where most of our cases are now seen. So we have currently...
Well, excuse me, were they homeless in El Cajon, La Mesa? I mean, were they residents, do we know, or did they just, this is where you found the people and identified the first cases, but they could have come from somewhere else, is that correct?
Absolutely. The cases were homeless, and as we know, homeless people do move around. They're very transient. When we identify where the individuals are from, we use several mechanisms, and we currently are working with the city of San Diego to have access to their database so that when EMS staff or officials pick up patients in a zip code, so the individuals could have been picked up in that zip code, but it doesn't necessarily mean that they lived in that particular zip code.
Thank you for clarifying that. Okay, we need a motion. So motion by Supervisor Horn, a second by Vice Chair Gaspar. For the staff recommendation on item 2, please vote.
Chairwoman Jacob, that motion passes unanimously with all board members who are present voting aye. Your final